Hello, this is Lavora Williams recording on the impact of microaggressions. I'm an associate professor in the University of Kentucky College of Nursing and happy to be recording this lecture for you all. Today we're going to define microaggression. We're going to develop awareness of its common occurrence, and then we're going to explore the impact on relationships and on the healthcare profession. We're going to discover techniques to minimize microaggressions, and then we're going to develop techniques to respond appropriately to microaggression. So to define microaggression, it's a grievous but superficially innocuous insult. It can be verbal, nonverbal, and are visual, and it's usually directed towards individuals who are different from the majority population. But oftentimes these microaggressions are unconscious, but yet they're degrading to the individual. It can be a verbal, it could be behavior, or it can be an environmental slight. It's often automatic and unintentional. It's a brief instance, not something that's progressive, but something that just happens during a normal day. But what it communicates is hostility, derogatory, or negative viewpoints concerning a population. It perpetuates prejudice and biases. And again, it's an isolated event that's manageable, but over time, it's devastating. So the instant that it happens, the person is able to manage it. But over time, these repeated degradations can become devastating. And for us, especially on a college university, it's all too easy to hurt and insult others when we're interacting with individuals whose lived experiences are different from our own. And this particularly matters in the context of universities because colleges are charged with providing an education in an environment in which everybody feels welcome. However, because of historical reasons, people from underrepresented groups and others who don't conform to the dominant demographics that's prevalent at most universities, they don't always feel welcome or included. And when microaggressions occur targeted at these groups, they only serve to amplify those feelings that these populations have of being alienated. Now, generally, microaggressions appear in three major forms. So they're micro assaults, which is old-fashioned racism, which is deliberate and explicit. Fortunately, we don't see as much of those explicit microaggression or racist behaviors as we used to, although they do seem to become more prevalent here in recent years. But generally, what we see are micro insults and micro invalidations. So these are unintentional and they occur due to underlying biases and prejudice that are outside of our awareness. And having microaggressions and being microaggressive, it doesn't make us racist. It just makes us a part of the environment in which we live. And so just being in the environment that we all operate in, we all have these underlying biases that oftentimes we're quite unaware of. But what it does is it causes people to feel different or other. For instance, It could be as innocent as, oh, I wouldn't have expected you to be a science major. Well, why not? Because I'm female? Or it could be as unintentional as being out with your friends and one of your friends has just graduated from college or landed that first new job, and you're out taking them out to celebrate, but you're the only person of color at the table. So when the check arrives, the waitress gives the check to the white male at the table. This is a microaggression, a biased view that this male must be the person with the income that can support this tab. So the server gives the check to that individual based on their underlying biases. Or it could be related to sexual gender identity. So, dude, I totally forgot you were gay when we played ball earlier, which implies that people who are gay cannot play basketball, that's something that they are incapable of doing. So this is somewhat of a contemporary racism, microaggression, but it's the impact of the words and the actions that matter more than the innocent, unintentional act. And then there's environmental microaggressions. And that's where the environment doesn't reflect the image of the person of color. So the everyday surroundings reflect the majority. And what it does is it decreases belongingness, and it causes the individual to feel that they are excluded from having their image reflected across the environment in which they work, go to school, etc. Micro insults convey insensitivity or rudeness, and they're demeaning to an individual's identity or heritage. For instance, a person may say, "You're so articulate," to an Hispanic male. So what does that convey? That Latinas are not articulate? Or there could be a physician of color, and when she or he enters the room, there's a belief that they are the nursing assistant or the nurse and not the physician, because there's this image of a physician being a non-person of color and typically a male person. Or it could be that there's a idea that because a student of color is a male, that they are here on an athletic scholarship. Or a person who has a background, a Spanish background, but their appearance doesn't fit the idea of someone with a Spanish background. So there's an invalidation of their heritage, that no, you're not Hispanic, you're white. So what these statements do is they assume that intelligence or a role model behavior is tied with the majority populations, so that when it's seen in an underrepresented population, that it's surprising to see this positive characteristic in this underrepresented population, because somehow this individual doesn't fit in the box that we have in our minds about that population. And then there are micro invalidations. And what micro invalidations do is they exclude, negate, or completely nullify an individual's thoughts, their feelings, or their experiences. For instance, it could be Ramadan. So this is a period of fasting and praying. But your office, you're having a cookout. So what you say to that person is, oh, I know it's Ramadan, but you can still come. So that's completely nullifying their beliefs and their practices. Or, oh, I'm colorblind. I don't see you as a Black woman. I don't see color. I just see people as human beings. Well, if you don't see the color of a Black person, you're invalidating the entire lived experience of that person of color. And you're not seeing who they are as a person of color. Or you're speaking to someone whose ancestry may not be from the United States. So there's a statement made, where are you from? And the person states, well, I'm from California, or I'm from Oregon. No, where are you really from? What that means to that person is that you are not American. You are not like me. Where are you really from? So even if America is their home, they never truly belong when they hear statements such as that. Or for gender sexual minorities, if there's an event and an invitation is sent out and it's addressed to Mr. and Mrs. Jones, it could be a same-sex couple. So that invalidates their partner. That invalidates their entire being of their life and who they are. Or if they have children, which one of you is the mom? They're both the moms, but that invalidates the role that that individual has with their child. So some people believe, like, so what? That microaggressions, they're innocent. It was just a joke. The person should get over it. That there are way more awful things than an innocent statement or a foot in the mouth. That they're just being overly dramatic. They're being too serious. And why can't these minor slights just be ignored, forgiven, or just laughed into disappearance? So viewed within the context of seemingly larger problems, the entire notion of microaggressions can seem trivial. And it's certainly worth exploring microaggressions on the basis of the link to microaggressions to implicit biases and the ways in which they can both telegraph and contribute to the proliferation of more invidious micro-level prejudices. But implicit biases have serious material consequences beyond hurt feelings, from discriminatory hiring to racial inequities to healthcare inequities to the broader U.S. criminal justice system. In other words, microaggressions matter because they seem to be both symptoms and causes of larger structural problems. There are psychological consequences to microaggressions: anxiety, depression, sleep difficulties, diminished confidence when there is a thought that because of who you are, that you are unable to accomplish. So the person loses their drive. And sometimes they have intrusive cognitions about who they are as an individual, their purpose, their ability to succeed in that environment. And then oftentimes there's this internal dilemma that causes the person to not focus on what they should, such as their studies or their job performance, and they have these intrusive thoughts. Did I interpret that correctly? Did they really mean what they said? Am I overreacting? Should I say something? No, maybe I shouldn't, because saying something might make it even worse. Microaggressions can have a negative impact on professional relationship. It can damage rapport and trust. It can cause disengagement, lack of motivation in the individual that the microaggression is targeted towards. It can even lead to underperformance. And it can have a detrimental effect of causing imposter syndrome, where the person begins to believe that they are somehow different, that they really shouldn't be here, that maybe they can't succeed in this environment. So they feel that they are an imposter, and that what people are saying about them may even be true. Microaggressions even manifest itself in the healthcare professions. Most often it's with interpersonal interactions with our colleagues, with our classmates, our peers, and then other times it has eternal dynamics. As far as interactions interpersonally, it could be our comfort level when we are simply uncomfortable being in the presence of someone who is unlike ourselves. And that discomfort manifests itself in how we build relationships or don't with people who are unlike ourselves, how we interact with them, where we're uncomfortable in social settings where there are people who are unlike us. With our patients, unfortunately, it can determine our assessment of that patient's condition. It can even determine how we categorize patients. If on our patient demographic form, if we only have male, female, we've completely lost the capacity to assess sexual and gender minorities when we know that there are health disparities in that population, but we can't capture because our healthcare demographic forms are still placing people in this box of male or female. It can even determine how we assess our patient and how we diagnose the patient. Research after research has shown that people of color are not, their pain level is not treated because there's this bias that the person may be drug seeking because they're from that population. It could even determine the outcome. There's so much data on African American women and their death rates with childbirth that even exists when their socioeconomic status is controlled for. It can even determine our response to conditions. For instance, the opioid epidemic. The opioid epidemic originally was a white population condition, whereas the crack epidemic, which was never referred to as an epidemic, was primarily an African American or people of color problem. And we can look at our response to the opioid epidemic and our response to the crack problem that we had years ago, whereas now we have funding to treat it. It's an epidemic. It can happen to anyone. We need treatment centers. We need more healthcare providers. Whereas crack was criminalized, where those individuals were weak in some way and they should be put into jail. That's the healthcare's response based on the dominance of a population in the healthcare profession. It can also affect our internal dynamics, how we collaborate with healthcare providers of color, who we refer to. If there is a physician of color, then we might tend to believe that we should refer the patients of color to that provider. And that may be true in some instances, but not if it's because we don't want to care for the patients who may be underinsured. It could affect our communication with our colleagues in healthcare. Research shows that healthcare members of color have more negative performance reviews. The internal dynamics could also occur in search committees and how we're evaluating applicants. We know that only 9% of physicians are physicians of color. We know that only 15% of nurse practitioners are people of color, and that the nursing profession has only 15 to 20% people of color. So those things manifest this way into the healthcare system and how decisions are made, allocations of resources, and what it results in is medical mistrust, inadequate medical care, and it results in health inequities. There's a student impact with microaggressions. Students oftentimes are isolated or feel isolated because of microinsults. Self-doubt, loss of confidence, stereotypical threat, failure, and even dropout. And moral stereotype threat, what that means is that there was a study done in 1995 where it showed that in several experiments that Black college freshmen and sophomores performed more poorly on standardized tests than white students when their race was emphasized. When race was not emphasized, however, the Black students performed better and equivalently with white students. And what those results showed is that performance within academic context can be harmed by the awareness that one's behavior might be viewed through the lens of racial stereotypes. So in other words, if we're telling students of color that oftentimes they won't do as well in math or science, then they tend to believe that and will do worse on standardized tests when others who are not told that will perform better. So there are actions that we can do to decrease microaggressions, but really it begins with ourselves. So we have to engage in self-reflection. We have to express genuine interest in individuals who are unlike ourselves. We have to avoid labeling or making assumptions about individuals based on their outward appearance. And we have to do all within our individual power to foster inclusive as well as supportive environments. And we have to hold others accountable. It's our responsibility to hold others accountable for their behaviors when we overhear microaggressive responses. So how do we respond? If we are in a setting where we hear a microaggression, we can redirect. We can make a comment such as, well, let's not go down that path. We can ask a question. What did you mean by saying that you don't believe XYZ? What did you mean by that? Could you please clarify? I don't understand that. You can challenge generalizations. It's like, I don't think that characteristic only applies to that population. Sometimes you can just walk away. If the microaggression, that the comment is made by someone who may be in authority, your professor or your boss, then you may not feel comfortable in challenging it. So sometimes you can just walk away. But what you don't want to do is engage in it. And if possible, you don't want to remain silent, because if you do, it's perpetuated. And as I said earlier, it's all of our responsibility to stop microaggression. And something that's easy to do is you can just say, ouch. So someone makes a comment that's negative towards your population, you can just say, oh, ouch, even if it's made to you. And that lets the person know that what they just said is harmful. It hurt you, or it hurt another population that you care about. Within the classroom, we can avoid calling out underrepresented students. We don't want students of color to feel that they are the voice for their entire population. We want to set high expectations for all of our students, no matter their background. And when we're discussing health inequities or health disparities, or we're discussing an ethnic group, and if one of our students is from that ethnic group, we don't want to lock eyes with that student when we're having that discussion. Because what that says is, you are othered. We recognize that this comment that I'm about to make about your people applies to you. But the information is for the entire class, not just that group. We want to do all we can to correctly pronounce ethnic names. That makes the person feel included. And it means that when you make that effort, that you care about them. And yes, you may say their name incorrectly numerous times, but you're trying, and it's okay. And you can say to that student, I know I'm going to butcher your name, but please continue to correct me. I'm trying, and I want to learn your name. And that lets them know that you care. Within our students, we want to make sure that we challenge our students. Oftentimes, our students come to us and they, for the first time in their lives, are being exposed to populations that's unlike the population that they grew up in. So we have to make sure that our students don't leave the university with that narrow worldview. We want them to have a complex worldview, because when they enter the workforce, when they enter the healthcare profession, they will be exposed to people unlike themselves, and they have to be culturally competent and able to care for that population and make that patient feel comfortable within the healthcare setting. So we have to challenge them to engage with difference, not to just assimilate with similarity and what's familiar to them. Well, let's say that it happened to you. You are the victim of microaggression. Initially, you just want to take a deep breath because you don't want to respond prematurely. You want to assume that the offense was not the intent because 95% of the time it was not intentional. And you want to focus on the offense, not the person. Sometimes it's helpful to ask, what did you mean by that comment? What do you mean you're surprised that I'm in medical school? So you're seeking clarification. And then you can explain, well, my interpretation of what you said is that Latina males cannot be in healthcare, or women cannot be scientists, that you're surprised by my being here. And that gives the person an opportunity to explain themselves or to even apologize. Sometimes it's helpful to use your friends as a sounding board. Like, am I overreacting? Or, how should I respond to that? And then again, when the microaggression is not directed to you or to your population, but it's directed to others, it's still our responsibility to address it. That's the only way that we can stop microaggressions. Now, there are some responses that are productive. So when the individual denies the offense, you can ask yourself, will further conversation even be helpful here, or should I just let it go? Am I too stressed right now to even engage in this discussion? Am I able to respond without crying or without yelling, just in a very clear manner without a lot of emotion? Now, if you do decide that you want to discuss it further, then take a deep breath. Reiterate that you're not blaming the person, but you're just expressing how the comment made you feel. Listen to their response and then move on. Let it go. Now, here's a little video about microaggression that you might find of interest.
I guess I'm still learning how to deal with microaggressions with mental illness and being a Black woman. It's something that I've always had.
The majority of the microaggressions that I've experienced in my life are related to being half Japanese. People often say that I am pretty for a Black girl, for example.
Oh my God, Kiana, like I'm Blacker than you are, Kiana. Like, oh my God.
From your name, I thought you'd be a little Jap walking off the streets.
Oh, you're super pretty for a Black girl.
A lot of people, they want to touch hair. There's one of them actions where they're just like, oh, can I see your hair? And they just go and pet it. When you pet something, you pet animals. We're humans. We're not animals.
The biggest one I get all the time is, what are you? What are you? And then they rattle off, because I'm so ethnically ambiguous, they rattle off this list of oh, are you Mexican? Native American? Puerto Rican? Yada, 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 yada. Why do you need to know that? I don't think it necessarily changes my intelligence or anything like that. It's just that you can put me in a nice little box.
It's disheartening to have people tell you you don't look like a particular group of people that you self-identify with. It's hard because I do self-identify as a Hispanic. I was born in Chile in South America. I feel like, how Chilean can I get? I don't know what else to do.
So then I try to model correct behavior. So if somebody says, where are you from? I will say, well, I grew up in California, but if you're talking about my ancestry, I'm Korean.
I have definitely experienced microaggressions the way that I look, whether it's like body type, especially. I think that's maybe one of the hardest.
I think it's a reality of privilege that you don't have to notice microaggressions.
What gives me a sense of agency to address microaggressions is honestly the identities that I have that are privileged. I think sometimes when a microaggression is done to me or others, I'm pretty quick to respond back or to clap back. But I often think sometimes that's hard to do. There are those times where, you want to educate that person. There are those times where you just want to run away, but then there's some times where you just have to have a good laugh.
I wasn't strong enough to say, like, what the heck? Like, what is, like, why did you say that? I wasn't strong enough to say that. And so I just had to, like, internalize my hurt and then kind of move on.
A lot of times, I don't think that people are trying to, what would you say, send microaggressions on purpose. I think that a lot of times microaggressions are, you're just not educated on what needs to be said or what you should say.
I think a lot of times people really just don't understand the impact of their words or their comments or something that has become a colloquialism in regularly exchanged conversation in our culture. A lot of times microaggressions are unconscious and people don't realize the impact, and a lot of times that wasn't their intent at all.
But at the end of the day, it doesn't matter about intent because it matters about how it impacted you.
Trying to help students to understand that we all have biases. They may not necessarily be, you may not necessarily know them, know exactly what they are, but I think we all have them. And once we can learn to understand those biases, I think that would be an important first step to understanding other people and their life experiences.
When I get challenged, it's hard and I feel embarrassed. And I'm somebody who thinks about that a lot. But I also want to honor the fact that I was the one who made that impact on the student. So you think about intent versus impact.
I think it's hugely important not to let that microaggression just pass by without anything being said. Because being silent is, to me, as an educator, stating that you agree with that particular microaggression.
True. So, as the video said, we're all guilty of microaggressions because we all have biases. So when we are the perpetrator and someone comes to us and they say, I didn't understand what you meant by that comment and it made me feel some kind of way, we have to listen. We have to make amends and apologize. Now, if the person offers, only if they offer, we can listen to their input on appropriate responses. Now, I say only if they offer because we have to understand that it's not the person's responsibility to educate us on appropriate behavior. It's our responsibility as healthcare clinicians to know how to be culturally competent and how to interact with people who are unlike ourselves. We have to self-reflect on the instance that occurred, and we have to try to understand why is it that we felt a certain way to cause us to make an inappropriate comment. Was it TV? Was it our parents? Was it because we're not exposed to people who are unlike ourselves? So we really have to self-reflect. And we have to restore trust with that person that we hurt. And a lot of times, well, all the times, that takes courage. Because generally what happens when we put our foot in our mouths or we say something, make a microaggression aggressive comment, we feel the shift in that relationship. We feel the dynamics change, but we don't say anything. So that person that we insulted will just walk away. They may not say anything, but we notice the next time when we engage with that person that they're a little different towards us. So what we do is, we try to be overly nice, try to make them feel comfortable, but they've lost trust in us. In order to restore that trust, we have to have that crucial conversation. We have to say, the other day, I said something inappropriate to you. And as soon as I said it, I knew it was offensive to you. I could tell by the look on your face. And I just want to talk about that because your relationship means a lot to me. And I just want to work on restoring what I broke the other day. And that's hard to do, but it's necessary if we're going to have authentic relationships with people who are unlike ourselves. So again, we have to self-educate. As I said earlier, it's not the person who's been offended's responsibility to educate us. There are so many different ways that we can educate ourselves. We can do it just by living, by traveling to cultures that are unlike our own, through service in communities that are unlike our own. Cultural festivals. Seems like there's a festival every weekend in Lexington related to a different culture. Movies sometimes can open up our minds towards another culture. There are so many books that we can read about implicit bias. There are online tests that we can take about implicit bias. And what these books and self-reflective activities do is it causes us to really look at ourselves and understand that we are part of the problem, and it's our responsibility as healthcare providers and clinicians to learn to do better. And we must have diverse friends. If you open your cell phone and you look at your contacts and everybody looks like you, everyone's from the background as yours. If you look at your social media contacts, if you look at your social media friends, if you look at your Facebook images and they all reflect your image, then you need to consider developing friendships with people who are unlike you. And it will open your mind and it will make you more comfortable dealing with patients who are unlike you. So in summary, there are multiple forms of microaggression. It occurs daily to underrepresented groups. It's unintentional, but yet it is harmful. It perpetuates biases. It communicates negative viewpoints. It can have devastating cumulative effects. But we're able to overcome it, and it's our responsibility to do so. Thank you for listening.